Good afternoon and welcome. Thank you all for joining us today. My name is Samantha, and I'm the Director of Member and Partner Services for the Florida Association of ACOs. We are very excited for this opportunity to present to you our next installment of our webinar series, How Virtual Care Drives Significant Savings for ACOs, presented by Neurofenix. Before we get started, I'd like to go over a few items so you know how to participate in today's event. You will see a user control panel on your computer desktop. You can listen in via your computer speakers, or if you would prefer to join over the phone, just select the arrow above the mute button and the dial-in information will be displayed. You will have the opportunity to submit text questions to today's presenters by typing your questions into the chat tab. You may send in your questions at any time during this presentation. We will collect them and address them during the Q&A session at the end of our presentation. With that, I'm going to turn our presentation over to Gilliam, who is going to give us a wonderful presentation.
Thank you so much, Samantha, for that kind introduction, and also for welcoming us as a member of FLACOS, is amazing organization, and for the opportunity to deliver this webinar to talk about something we're very passionate about, which is virtual care and how it helps patients and it delivers cost savings for ACOs. So before we start, just wanted to introduce myself and my fellow speaker, Katie. My background, I'm a biomedical engineer, did a master's in neurotechnology and have over a decade of experience in neuro rehab and virtual care. And here with me today, Katie Riccio, our clinical service manager. She has close to 20 years of experience as an occupational therapist in adult neuro rehabilitation and one of the leading rehab hospitals in the country. So we will both be talking throughout this webinar, and hopefully you'll find it extremely helpful and interesting. So we'll start with the basics. What is virtual care? So there's hundreds of definitions out there, and it can get very confusing and confused between what is telehealth, what's telemedicine. So virtual care really captures all key digital interactions between a provider and a patient. This means that when a provider is remotely treating a patient, that's part of virtual care, and virtual care includes telehealth and telemedicine within it. There's many key components on virtual care, and we've really summarized the 10 most common ones in this slide. Starting from the left, live video conferencing. Most of us are familiar with this part of virtual care. This is real-time, two-way communication between a provider and a patient, usually synchronous communication. E-visits, that's usually secure communication between the patient and the provider using SMS, so text messages, phone calls, and emails. E-prescriptions, so electronic prescriptions, that's where a provider delivers those prescriptions to the patient remotely without that in-person visit. Remote patient monitoring and remote therapeutic monitoring, they tend to be confused. Remote patient monitoring monitors physiological data like glucose levels, heart rate, and that's usually tracked with medical devices remotely. While remote therapeutic monitoring, it measures non-physiological data like the adherence of a patient to their therapy plan and their self-reported pain levels. And also this data is measured with medical devices. Mobile health is also a key part of virtual care, and it includes mobile applications that run on the patient's smartphones or tablets. And it can include applications that help on medication reminders and self-tracking for the patient to monitor their own health. Another key component is digital therapeutics, which are software-based interventions that can use some medical devices, and they deliver a therapeutic intervention remotely. One of the centerpieces of virtual care is the EHR, electronic health record system, to exchange information between different providers delivering care in person and remotely. And then health coaches are a key component also of virtual care, very common in many virtual care programs. And they tend to be non-clinical, and they help patients with motivation, and sticking to their therapy plans and their plan of care at home. Finally, online billing and payments make paying medical bills convenient to patients and providers, streamlining their billing processes. So as you can see, virtual care is a very broad term. I think it includes all these services and technology. But the key here is why care? Why do we care about virtual care? So the key here is that virtual care is here to stay. There's many indicators that show that virtual care adoption is still, and it will remain high. Telehealth adoption is 17 times higher than before the pandemic, with Medicare patients, fee-for-service Medicare patients, around 25% of them receiving a telehealth service in 2023. And there's many experts that agree that telehealth will remain at around 20% in 2024 onwards. So what about patients experiencing virtual care and their experience? Patients love virtual care. There's a lot of reports that you can read that the patient satisfaction is very high. Interesting one shows that patients who received virtual care in the last 12 months, 90% of them, 89% of them, sorry, want to continue using virtual care in their future. And a very interesting analysis that we did in preparation of this webinar is we looked at the top 10 ACOs achieving cost savings. And we saw that 8 out of 10 of the leading ACOs incorporate virtual care as part of their strategy to improve outcomes and cut costs. So definitely there's a lot of indication that virtual care is here to stay. So what are the key benefits of virtual care? The most obvious one is expanded access to care, where patients are able to access primary care and specialists remotely without the challenges of transportation. And that really allows rural areas, underserved areas to access care. And that really allows patients that otherwise will not be able to access any of this care. It also allows faster access to care, so avoiding waiting lists.
If you want to do any kind of...
Avoiding long waiting lists and being able to access care even on the same day with same-day virtual appointments. And really avoiding those patients that are suffering from any indication that could exacerbate if they don't see someone quickly. The third one is improved chronic disease management. This really means virtual care allows to monitor chronic patients remotely in real time and allows providers to monitor them and avoid those costly escalations. Another key benefit is increased provider efficiency. This is allowing patients, so virtual care is allowing patients to access care quickly, but also the providers are able to streamline their workflows and reduce their no-shows quite significantly with virtual care. And finally, delivering cost savings. So this is obviously one of the key topics of virtual care. And it can really, as we will see today, deliver significant cost savings by eliminating unnecessary unplanned hospital readmissions and many other costs that can be avoided by the use of virtual care. So what makes a successful virtual care program? So we've divided the key elements or the key requirements for a successful virtual care program in 3 main pillars. The first one is the foundational structure and team. So a successful virtual care program needs to have a very clear target population, very clear inclusion and exclusion criteria, and clear integration with the existing standard of care and existing provider workflows. The virtual care team needs to be fully trained and very experienced in delivering care. And this means having robust protocols and processes to deliver that care, step-by-step plans on how to deal with different challenges, and to make sure that everyone delivering virtual care is fully trained and continuously trained. Evidence-based programs are key. So any program that's delivered virtually needs to have evidence behind it, different clinical trials behind it, And the outcomes that we choose for those virtual care programs need to be standardized and needs to be widely accepted, so they can also be compared and benchmarked against in-person treatments if necessary. The second pillar is the technology and integration. So it's very important to have an all-in-one platform that integrates the EHR, the patient provider communication, any remote patient devices, and also a provider dashboard so that you can really see, so the providers can really see what the patient is doing remotely and quickly react if necessary. Ease of use is essential. So it has to be very easy to use for a patient, especially those elderly patients that might not be as tech savvy. So it has to be super simple. And then also for the providers, it needs to be easy to use to access the dashboard and to check what the patients are doing. So ease of use is essential. The third component here is security and compliance. So obviously being HIPAA compliant and having a robust data security plan and protocol in place before even starting to deliver virtual care, making sure all the data is secure. The third pillar is patient-centered care. Without patient engagement, we really cannot motivate patients, or we cannot engage patients in virtual care. So having tools like a patient application, using gamification like games to motivate patients, and using educational tools like content, video content, written content to empower the patient to take care of their health is a key pillar too. Every virtual care program, for it to be successful, needs to have a clear reimbursement strategy, meaning clear CPT codes that are going to be used, or DME codes. So it needs to be also covered by insurance of as many patients as possible, original Medicare, MA, and have the lowest patient out-of-pocket cost as possible. Finally, a successful virtual care program needs to be personalized. And that's one of the powers of also virtual care. We're tracking all this data of this patient. So the provider, in a simple way, needs to be able to remotely adjust the plan of care based on the individual needs, the progress or the lack of progress of that patient, and also intervene quickly in case there's any issue that could lead the patient to go to hospital. So that really allows true personalized care. Great. So now you know what a successful virtual care program needs to look. There's many requirements. It's not easy if you're thinking of developing it your own. And the question that remains is, what are the right patients for virtual care? So unfortunately, there's no one size fits all for virtual care. It really depends on the patient population. However, we've extracted 5 key questions that providers can ask their patients to ensure that they can benefit from virtual care. The first one is, does the patient have internet at home? Obviously, this is key for video visits and to be able to access the patient app if they have one, and for the data of the remote devices to be transmitting that data to the provider dashboard. So does the patient have internet at home is a key question to ask. The second one is, can the health needs of the patient be met virtually? And I think this is very important. Not all patients can benefit from virtual care. If we think about a patient that's severely cognitively impaired or physically impaired, that really needs a lot of support, and this person could really benefit from in-person care, then they should not receive virtual care. So making sure that we're really thoughtful about which patients can really benefit and if the needs of the patient can be met virtually or not. Third question is the patient comfortable with technology? And I think this can be seen by the fact that if they use a smartwatch already, or a smartphone, or they use their laptop a lot, their computer, if they're not tech savvy, they can still potentially have a family member or caregiver to support them with the use of the technology. But if they are not tech savvy at all, they have nobody to support them, and they're not comfortable, they might not be suitable for virtual care. And then the fourth question is transportation. So if the patient doesn't have a reliable transportation to go to in-person appointments, there's a huge barrier for care. So if they don't have that transportation, they might be a great candidate for virtual care. I read a report that said that Medicare patients are willing to travel up to 18 miles to receive care. So if, let's say, is a stroke patient that needs rehab and their outpatient clinic is 25 miles away and they don't have a reliable source of transportation, they could be a great candidate for virtual care. The other key question, the fifth question, is what is their preference? So it's very important not to forget to ask the patient, do they want to receive virtual care or they really want in-person care? So make sure we always ask the preference of the patient in any of the workflows that we create to select the right patients. Hopefully these 5 key questions are a great start to select the right patients, and then you can then add more questions based on the specific patient population. So now that you know how to select the right patients, I would love to move to 3 great success stories on the use of virtual care to improve outcomes, patient satisfaction, and also deliver cost savings. These are the 3 key companies I'm going to walk you through today: Heartbeat Health, Hinge Health, and Neurofenix. Heartbeat Health delivers cardiovascular virtual care. They focus on patients Medicare patients with moderate to high risk of cardiovascular diseases. This includes patients with heart failure, heart valve disease, hypertension. Hinge Health focuses on delivering musculoskeletal virtual care, MSK care, and they care for patients that have osteoarthritis, rheumatoid arthritis, musculoskeletal pain like back pain, to name a few. And Neurofenix focuses on neurological virtual care, focusing on stroke survivors, TBI patients, spinal cord, Alzheimer's, Parkinson's, to name a few. So as you can see today, I will present each of these companies, how they deliver virtual care, their programs, the problems they're solving, and the outcomes they're getting. And hopefully they will be inspiring. Starting with Heartbeat Health, the problem they're solving is that it's very common for Medicare patients to have one heart condition. Heart failure patients readmit very frequently. 25% of heart failure patients readmit within 30 days, and it's quite expensive per readmission. And it's very difficult for many patients to access a cardiologist and the cardiac rehab they need. So that's the problem they're solving. The solution that Heartbeat Health developed is a virtual care program that lasts 13 weeks, and it includes televisits, it includes remote patient monitoring, it includes care coordination with the primary care physician of the patient. The providers of this program are virtual cardiologists and virtual nurses, and the technologies used are Heartbeat Health collects data from the patient's smartphone, smartwatch, and smart scale. But they also ship a patch heart monitor called the Zio patch and use artificial intelligence to predict escalations. They've treated hundreds of thousands of patients, and they've shown that they can improve blood pressure control, improve the independence of their patients, and all of this with a very high patient satisfaction. So what about cost savings? So the average cost of a heart failure patient, Medicare heart failure patient, is around $24,000. And they proved that they can save around $6,000, so 25% cost savings, compared to a control group that receives in-person cardiology care. How they achieve this cost savings? By reducing the hospital readmissions, all costs, and cardiovascular-related readmissions by more than half, actually. So that's a great success story about how to use virtual care in a difficult population to achieve great outcomes and cost savings. So let's move to the second one, Hinge Health. They're focusing on MSK virtual care. The problem they're solving is that MSK disorders are very common in the Medicare population. They're very expensive too, and it's very difficult for them to access the care they need. The program they develop is a 12-week virtual MSK program that includes also televisits. It includes an exercise therapy program, remote patient monitoring devices, and they send a wearable pain management device to the patient's home and use computer vision to track the motion of the patient. It's delivered by virtual physical therapists, virtual health coaches, and virtual orthopedic surgeons who supervise the program. They've treated, I believe, up to 1 million patients now. So they've been very successful. They've reduced the pain of patients significantly, also depression and anxiety, and they have a very high patient satisfaction. They've proven their cost savings. The average cost of Medicare patients with one or more MSK disorders is around $12,000, and they deliver around $3,000 cost savings, so 28%, compared to patients to a control group receiving in-person physical therapy. How they achieve this? They reduce hospital inpatient days, outpatient visits, they reduce the amount of surgeries, and also reduce in-person PT visits, physical therapy visits. So another great success story that hopefully is inspiring you and showcasing the power of virtual care. Regarding Neurofenix, the problem that Neurofenix is solving is the high prevalence of neurological disorders in the Medicare population, including strokes. 1 in 5 strokes get readmitted within 30 days, and it's very expensive per readmission, so $10,000 per stroke-related readmission. And it's very difficult for patients to access the neuro rehab services they need. This tends to be because of lack of transportation, but also long waiting lists tend to make it very hard for these patients to access the care they need in a convenient manner. The solution, an 8 to 16-week virtual neuro rehab program. The providers that we use are virtual neurotherapists and virtual neurologists. The program itself includes weekly televisits, remote therapeutic monitoring devices, clinician dashboard for the therapist to remotely check patients. It includes care coordination too. And it's powered by a neuro rehab platform. We call it the Neuro platform, that includes therapeutic video exercise and games to motivate the patients. And we ship to the patients a home neuro rehab kit that includes a fully set up tablet and all the devices they need to follow their plan of care. So what about the patient outcomes? I love sharing that with everyone. Every patient who enrolls in the program and then graduates from the program achieves at least one of their goals. Actually, the average is at least 8 out of their 10 patient goals are achieved at graduation. We have very, very high adherence, 175% adherence, which means that patients are doing more than what the therapist tells them, which is great, and very, very high patient satisfaction, which is obviously essential for any virtual care program. In terms of estimated cost savings, the annual cost of a Medicare patient having a stroke is around $32,000, so very expensive. And we estimate we can save 25% of that, which is $8,000. How? By reducing hospital readmissions, by managing any exacerbation and any symptom before it escalates, by also reducing emergency care visits, and urgent care visits, reducing falls by improving balance and mobility, and reducing the risk factors associated with recurring strokes. Also, that really can significantly bend the cost curve. Great, so that's the third successful story, and hopefully now you've seen the use of virtual care in a wide range of Medicare patients, and you are excited about the potential that it has to improve outcomes and deliver cost savings. So now I always love hearing about patients and their experience with virtual care and how it can help improve their lives. So I would love to invite Katie Riccio, our clinical services manager, to the stage to present a case study of a patient actually benefiting from virtual care. So let me make sure I spotlight her so you can see her well.
Thank you, VM. My name is Katie Riccio, and I lead the development and the delivery of our virtual neuro rehab program. And today I'd like to tell you about one of our stroke patients' journey through our virtual program, so you can see what success looks like for a patient experiencing virtual care. You could go ahead and switch the slide. So this is Diana. Diana is a 50-year-old stroke survivor, and she experienced an ischemic stroke 2 years ago, resulting in left-sided hemiparesis. So she had weakness in her left arm, decreased range of motion, and the decreased ability to open and close her hand. Diana also has a secondary diagnosis of lupus and a history of hypertension, and she also had a valve replacement in her heart. And I'm mentioning this because it was her medication mismanagement which led to her stroke. When we evaluated Diana for our virtual care program, she struggled with basic everyday tasks due to her physical impairments, and she also relied on her husband to help her get dressed, to help her perform grooming tasks such as combing her hair and putting in a ponytail, and she needed assistance with meal prep activities, such as opening her containers and cutting her food. But one of her biggest concerns was that she was constantly losing her balance when dressing, which put her at a risk for falls. She attended in-person therapy in the past, but she had difficulty with the consistency because her husband had to drive her and he could not always take off work to get her to therapy. Plus, she often missed therapy sessions due to unexpected traffic. So Diana discovered our neurological virtual care program, and she was eager to enroll since she would not have to worry about the transportation barrier, and she was comfortable using technology for video calls. During our comprehensive evaluation, we discussed the goals for increasing range of motion, function in her left arm, as well as regaining functional independence in basic tasks, so she did not have to rely on her husband's assistance. Go ahead and switch to the next slide. Diana was a great candidate for our virtual program, and we quickly sent out our home neuro rehab kit directly to her house, preset with her therapy program. We worked with her for 16 weeks, providing weekly one-to-one personalized therapy sessions using evidence-based strategies and task-specific training. We monitored her adherence and her dosage while she was using a sensor-based upper limb medical device called the Neuro. And in between those sessions, we communicated multiple times a week to provide motivation and support. We also communicated with her physician team to maintain the consistency of care as she was receiving Botox injections, and we were able to discuss the effectiveness of the dosage with the possibility of reducing the dosage or lengthening the frequency. Donna maintained an above average adherence to her exercises and her therapeutic activities. And after those 16 weeks, she was able to use her arm to zip up her pants and button her shirt. She was able to cut her food in open containers. She was able to comb her hair and put in a ponytail, all reducing the caregiver burden from her husband. She was also able to increase her balance, and she no longer tipped over while dressing, which assisted to help prevent future falls and possible escalations leading to an urgent care visit. And lastly, she improved her overall health score from a reported 25 out of 100 to 75 out of 100. And she developed lifestyle management strategies to manage her chronic condition. So at the end of the program, we set Diana up with a home program to continue with her exercises and activities. And we discussed ways to manage her chronic conditions of stroke, lupus, and hypertension to help her avoid any exacerbations that could lead to a hospital readmission. She reports that the virtual program helped to hold her accountable, and the frequent check-ins were important to keep her on track, and they helped her to develop a routine and a healthier lifestyle. So overall, this is just an example with one of our most recent patients, and her case study highlights how virtual care improved her therapy adherence and her overall functional independence and lifestyle management, leading to cost savings.
Thank you very much, Katie. Very inspiring. I love hearing about patients who benefit from virtual care. Let me quickly continue here. So we're reaching the end of the webinar. I want to summarize some of the key takeaways. First one, we went through the definition of virtual care and the key components that include virtual care, why we believe virtual care is here to stay, and there's strong indications of that with patients loving it, and the top ACOs adopting virtual care and embracing it. We went through some of the key requirements of how to develop a successful virtual care program. There's many of them. Also we discussed the different questions you can ask a patient to see if they're actually appropriate for virtual care, but with the warning that no one size fits all, and that each virtual care program needs its own inclusion and exclusion criteria and needs to be iterated to make sure that only the patients that can really benefit are accepted. We went through 3 success stories: Heartbeat Health, Hinge Health, Neurofenix, of virtual care programs that can and improved patient outcomes, patient satisfaction, and can deliver significant cost savings. We then thank you again, Katie, for going through the patient case study and the amazing story of Diana and how virtual care really was basically almost the only possibility for her, and how it really changed her life. So I would love to use the opportunity to mention that we are offering pilots to leading ACOs that want to test virtual neuro rehab program, our virtual neuro rehab program, to reduce their costs and set their care apart. And if you're interested or just want to have another chat and learn more about us, you can contact me directly at the email and phone number that you can see here. And we have also more information on our website that hopefully you will find extremely helpful. So now we can go to our questions and answer section. You can ask us anything, and I'll make sure I stop spotlighting me so you can see everyone else. And if you want Katie to turn on your video and audio, we'll look forward to hearing and replying to any of the questions that you have.
Okay, so one of our first questions that we did have for you today is, how do you measure patient outcomes? Which outcomes do you track, and how frequently are they assessed?
Great. Thank you, Samantha, for that question. And Katie, I think, do you mind taking that question?
Sure, thank you. We measure a wide range of outcomes from objective measurements and patient-reported outcomes. We are evaluating and taking those outcome measurements on our first initial evaluation with the patient, and then we reassess them every 4 weeks throughout the program. Once they graduate, we're also reassessing them at 1 month, 3 months, 6 months, and 12 months post-graduation to ensure we capture those long-term outcomes.
That's perfect. Thank you so much, Katie, and thank you for that question.
Second question I have for you today is, how do you ensure coordination of care, and do you communicate with the patient's PCP?
Perfect.
Thank you, Samantha, for the question. I think, Katie, that's also for you.
Sure. Yes, we provide that coordination of care with all of our patients as part of our program. Each patient will get their own Neurofenix virtual therapist throughout the program, who becomes that single point of contact for the PCP, for the neurologist, for the case managers, or the coordinators. And we're making sure that we're also sending weekly and monthly reports to the primary care physician as well. And any other requests, we will also send that information over. But we're in constant communication with the patient. We monitor them remotely, and we can also direct them to the right site of service when needed.
Thank you so much, Katie.
Another question I had for you was, can you explain the initial evaluation process in your virtual care program, including your coding practices?
Okay, initial evaluation and coding practices. Again, Katie, I think you're the best person to answer that.
Sure. During our initial evaluation, we are documenting their medical history, their social history, and as I mentioned, we are taking those objective measurements and the patient-reported outcomes. We're also screening those patients to make sure that they're appropriate for virtual care services. And then we code the evaluation using the ICD-10 codes, and we use the CPT codes as well for any therapeutic intervention. We are also working on publishing a white paper showing that virtual therapists can improve the coding for stroke patients as we understand there's complexities to these patients. So we're making sure that we're addressing HCC codes as well with our program.
Thank you, Katie. Another great question.
Another one for you. How do you estimate the cost savings for your virtual care program?
Cost savings of our virtual care program, I think Angela Green, our VP of Business Development. Angela, if you don't mind turning on your video and sound.
Sure. Can you hear me?
We can hear you.
Okay, great. So we worked with a reputable actuarial analytics company, and we looked at a detailed cost for Medicare patients after having a stroke and receiving the standard of care. And it involves more traditional therapy. And then we estimated all the key cost savings that our virtual care program can generate based on reducing escalations, including unplanned hospital admissions, ER and urgent care visits, reduction of falls. Something we noticed during our program is while patients may have had a history of falls, they never fell during our program. And we're hoping to continue to prove that out over time once they're discharged, and as Katie mentioned, that we're following up with them. So we're hoping that, 1 year out, they're still not falling, because we have a great program to keep that from happening. We also want to, reduce the risk factors with recurrent strokes. So the medication adherence encourage that, and, overall health and wellness.
Perfect. Thank you so much, Angela. You can stay here in case there's more questions.
It looks like the last question I did have for you today is, which insurance providers are you contracted with?
Insurance providers, Sabina, our Senior Finance Director, if you don't mind taking that one.
Sure, thank you for the question. We take original Medicare, and we are credentialing with Medicaid and over 100 Medicare Advantage plans, including plans from United Healthcare, Aetna, Blue Cross, Blue Shield, just to mention a few of those.
Brilliant. Thank you so much, Sabina.
That looks like all the questions that I had on my side.
Brilliant. Okay, I know we've been going quite quick on the webinar, which is great. Hopefully you found it very helpful. And I also, whoever wants the slides, please feel free to email me, and you can also access all the references that we used for this presentation. So at this point, I'll stop sharing the screen.
Thank you all for this wonderful presentation. I know I learned a lot on behalf of the association myself, and thank you for presenting this information. After the webinar, we will be sending an email with contact information. If you have any follow-up questions and a link to the webinar recording, please feel free to share that link with anyone that you think may be interested in learning more about this wonderful presentation. Also, just wanted to remind everyone that our fall conference is coming up this November 20th through the 22nd in Orlando, and we hope to see you all there. Thank you again for your time, and hope everyone has a great day.
Thank you so much, Samantha, for inviting us to do this webinar. We will be at that conference for sure. And thank you everyone for attending, and hope you find it very helpful.
Have a great day.
Have a great day.
Thank you. Have a nice day. Bye.
Thank you. You too.